brachial plexus in under a minute. So this plexus is going to consist of spinal nerves C5 through T1. Each of these spinal nerves are going to intertwine to create our trunks. We have 3 trunks, upper, middle, and lower. Each of these trunks are going to give off anterior and posterior axons, which are also going to intertwine to create our cords. We have 3 cords, lateral, posterior, and medial. These cords are going to be centered around our axillary artery, which is going to travel straight through our brachial plexus. So first we're going to talk about our posterior cord, which is going to give off one major nerve, which is going to be our radial artery. Our radial artery is going to travel along the posterior side of our arm to supply our posterior arm muscles and our forearm muscles. It also gives off the axillary nerve, which is going to travel around the shoulder to supply our deltoids and teres minor. Our posterior cord is also going to give off our subscapular nerves and thoracodorsal nerve, which is going to supply your latissimus dorsi and your subscapularis and teres major. Now going off to our other cords, our lateral and medial cords are each going to give off one branch to create our median nerve. Our median nerve is going to travel down the anterior side of our arm through our cubital fossa to supply 6.5 anterior forearm muscles, and then enter your hand through the carpal tunnel to supply your thenar hand muscles. Your lateral cord is also going to give off your lateral pectoral nerve to supply your pectoralis major, and your musculocutaneous nerve, which pierces through your coracobrachialis to supply all of your anterior arm muscles. Your medial cord is going to give off your medial pectoral nerve to supply both of your pectoralis muscles, and your ulnar nerve, which is also going to travel down your anterior forearm to supply 1.5 anterior forearm muscles, and then enter your hand not through the carpal tunnel to supply your hypothenar and central hand muscles. Now going back to these miscellaneous nerves, your subscapular nerve is going to come off your upper trunk to supply your supra and infraspinatus. Your dorsal scapular nerve is directly going to come off of C5 to supply your levator scapulae and your rhomboids. And your long thoracic is going to come off of C5 through C7 to supply your serratus anterior. If you want to learn more and more in depth, follow our YouTube channel.